Hi, I'm Brian Myers. I'm a physician assistant here at Kaiser Baseline in primary care, and I'm here to talk to you about procedure setup standardization for laceration repair. And the goal of this video is to discuss how to properly set up for a primary care provider or an urgent care provider in regards to doing laceration repair, such as doing stitches. And like all of our procedure standardization setup videos, we have a photo that is like a visual recipe that shows all the ingredients that need to be set up in order to prepare properly for this procedure. And then I've taken this photo today and set up the actual procedure so that it's ready and we can go through it. When we're setting up, the first thing as far as laceration prep I want to talk about is that we're going to break this into 4 categories. First is setting up your materials, and then cleaning the laceration site, and then preparing for bandaging, and finally making a follow-up appointment. So first of all, setting up for the procedure. So for all of our procedures, we want to set up on top of a sheet of nice white paper or on a chuck, because a lot of our surfaces are tarnished or worn, and we want to make sure that we're giving our patients the red carpet treatment here and showing them that we're really a precise clinic. So as far as setting up for laceration repair, you're going to get out a laceration pack, and this is going to have all the tools in it for your provider to be able to sew and put stitches into a patient. After you have this set up on the Mayo stand, which is a rolling stand that can be brought over to the patient, you're going to set up the remainder of the ingredients for this procedure. So things that we're going to need for this procedure, first of all, we're going to need to numb the site that's going to be sewed. And in order to numb, we're going to need a syringe, we'll need a needle. Before we can put all this into someone's body, we have to be able to sterilize the skin. Providers like if you can put out an alcohol pad so that they can wipe off the top of the bottles prior to drawing up their lidocaine. Also, something to keep in mind is if you're doing a procedure that's going to be on the torso and not on a finger or nose or toe, you want to use lidocaine with epinephrine to cut down on bleeding. Also lay out some sodium bicarb to help make that injection hurt less. That's what sodium bicarb does. And it also is nice to put out some ethyl chloride to cool the skin prior to these injections, and that's all for the patient's comfort. Other stuff we're going to need is we're going to need a sterile drape, and this has a hole in it, and your provider will be putting that on top of the wound just prior to sewing it. We're going to need a couple of containers of gauze sponges, because as you know, a lot of these lacerations are going to bleed a lot while we're cleaning them and while we're sewing. And we're going to need sterile saline to irrigate out the wound prior to sewing it. And we're going to need a basin to pour the saline in, and a large syringe that we can pull up saline in and then irrigate out a wound. Also, when we're irrigating wounds, we want to have something on the tip of our device to prevent spray and splashing and getting stuff in your eyes. And in that case, this is called a Zero Wet Super Shield, which I think is a pretty fancy name. But basically, this goes onto the tip here and provides a bell-like surface so that when we're irrigating a wound, we're not spraying water and saline all over the room. So these are kind of the items we want to lay out for the laceration preparation, excuse me. And then finally, we want to have out things for bandaging afterwards. So we want to go ahead and cut some HIPAFIX, which is a cloth adhesive dressing that breathes and is absorbent. And we want to have out some non-adherent gauze. So whenever we're bandaging a wound, we always want to use non-adherent gauze as our first layer. And then we can put additional gauze sponge and then the HIPAFIX to absorb any bleeding or discharge. One of the common things I see happen when patients come from other ERs, not obviously Kaiser ERs, is that they come with a wound bandage with one of the cottony type gauzes on it, and it gets adhered in the wound and causes all kinds of problems later. So moving right along as far as preparing the patient for this procedure. So after you've got it set up, you'll bring your patient back. You'll make sure that the patient is pulled up on the computer for your provider. And then you want to make sure the patient gets into a gown if it's on their torso, or shorts on their legs, so that we don't ruin any clothes with blood. And then please lay out several chucks underneath the site to absorb any of this saline that we're going to be irrigating with, so that the patient's not sitting in a puddle of water. Turn on the light and adjust it so that it's focused on the wound site. After you have the patient set up, I want you to come and find your provider that you're working with who will be doing this sewing or stitches, and I want you to bring them to the room quickly so that they can numb the site, so that you can then begin cleaning out the wound. So the goal is, if the provider can walk in quickly and numb the site, then you can begin irrigating it and cleaning the wound in the way that we discussed. So that's going to be at least 1 liter of saline. It's going to be large syringes of saline, and we're just irrigating out that laceration site. And after you've used at least 1 liter of saline, you'll come and find your provider, and then they'll finish the procedure off. And that, in this case, is going to be, they'll be sewing the stitches that you've put out. A good thread to put out is 5/0 because it works for a lot of scenarios. And they're going to glove up, put the drape down, sew the patient, and then if you've laid out supplies for dressing the wound, they may be able to dress it then, or the supplies are already laid out so that they can buzz you and have you come back to help dress the wound. So the final step, though, after we've done everything for this procedure, is to make sure that you set up the patient's follow-up appointment. So after you've helped with dressing, all stitches have to come out. And so this patient's going to have to come back and have that done. And we want you to make sure you're proactively doing that for your provider by setting up for a 5-day follow-up for faces. For anything on the torso or extremity, that's going to be 10 days, unless, of course, it's on an elbow, knee, or knuckle, and those are going to be 14-day follow-ups because those sites are prone to pulling apart, and we want to really push how long we leave the stitches in for. And then you can, after you've done that, you'll be able to discharge your patient, and everything will have gone as quickly and smoothly as possible. So thanks again for setting up everything, using our pictures, and getting everything out so that the procedure can run smoothly. Great job.